everyone. My name is Mark Skidmore. I'm the director of the North Central Regional Center for Rural Development. And today's webinar is Reducing Rural Cancer Disparities Together. This project is funded by the USDA National Institute of Food and Agriculture through the Rural Health and Safety Education Competitive Grants Program. And our presenters are Katie Rowe, Marianne Schilling, and Kathy Statz, all of whom are with the University of Wisconsin Extension, along with Cody Frederick, who is at the University of Wisconsin Carbone Cancer Center. And so the goal, it's a collaborative effort between the University of Wisconsin Extension and the University of Wisconsin Carbone Center. The dual purpose of the project are to increase the understanding and skills of rural residents to make informed health decisions related to cancer prevention while building capacity and health-focused coalitions to address rural health needs. So with that brief introduction, I'd like to thank the presenters for taking time to share their work with us, and I guess I pass it on to the presenters. And thanks again for everyone joining us.
Thank you, Mark, for having us. This is Katie Rowe from University of Wisconsin Extension. I'm just going to kick us off, give you a little bit more in-depth background on the project, and then turn it over to some of our project team who are really the boots on the ground development and delivery team for this project. I'll start it off by reiterating what Mark said. We were funded by NIFA this past 2 years as the first cycle of grant funding under their Rural Health and Safety Education grants. So our funding started in September 2015, and we'll be wrapping up the 2-year project at the end of August this year. Mark, thank you for introducing our presenter team. In addition, there's just a couple other key folks that have been involved. You can see listed here. I'll add Rick Strickland, who's also with the UW Carbone Cancer Center, was key in our planning team, and as well Ann Keim, who's our interim family living programs director here at UW Extension, and she's the PI on the project and actually one of the key people who wrote the grant. As Mark said, we're going to give you an overview of our project today. We're going to highlight some of the components of the direct education part of the program titled Cancer Clear and Simple. We're also going to talk some about our systems change efforts through this project that is happening through coalition coaching, and also some ways we tried to bolster some of the existing evaluation measures around Cancer Clear and Simple, as well as develop sort of a cohesive logic model and evaluation plan for the project in its entirety, which was largely something I was responsible for. So why did we even pick this project to begin with? You can see some of the history of the risks and what we knew to be true in rural areas of Wisconsin listed here on this slide. As compared to urban counterparts, we knew that rural residents were more likely to be diagnosed with cancer at later stages, have less access to medical treatment, in some cases receive poor quality care depending on their locations. Rural residents also engaged in risky behaviors at a higher rate than their urban counterparts, such as smoking and lack of exercise. They were also more likely to be uninsured. And there's a multitude of reasons behind these various factors, but the sum total leads us to identify that in certain counties, residents were more likely to be at risk for cancer and have also, in cases, higher mortality from cancer than their urban counterparts. So that's sort of the purpose that for us getting involved in writing the grant that we did. As we've said, there's a prevention education component, which is directed at individuals, guiding some knowledge increase and awareness around cancer risk and motivating towards behavior change. We're working on the systems level. You'll hear more about that to try to look at policy systems and environments that may contribute to disparities and help communities address those. And finally, again, we're looking to measure the effectiveness of the program through a variety of evaluation measures. This is our logic model, and I certainly don't expect you to be able to read this slide in any detail, or maybe even at all, depending on your screen size. That is okay. What I wanted to point out is that this project does have a cohesive logic model that we developed together as a planning team, and it links both the direct education components and the community systems change efforts into one cohesive project with joint long-term outcomes. So if you just follow with me for a second the color coding here, if you look at the blue boxes across the top, that moves from the outputs and outcomes that make up the thread that demonstrate our activities and outcomes for participants in the direct education program. So, for example, some medium-term outcomes, I'm going to try to point to them if I can make my pointer work. Yeah, the medium-term outcomes that would be associated with what we're hoping participants get out of our direct education program might be increasing healthy lifestyle behaviors or increasing their rate of completing recommended cancer screenings. The yellow thread that goes through the logic model represents outputs and outcomes related to the facilitators that we train to deliver the prevention education program. So outcomes for facilitators might include increasing their confidence, skills, and capacity to teach direct education related to cancer prevention. They might also include that facilitators understand the health literacy underpinning of the direct education program. And finally, this pink/purple thread represents the systems change community coalition efforts we're working on. And some of the medium to long-term outcomes we might expect for coalitions that are participating in the project include having coalition leaders increase their confidence in working in their coalitions around policy systems and environmental change work, or that they'll actually put in place, prioritize, and implement policy systems or environmental change work. And most importantly, what I hope you get out of this is you'll see with the arrows connecting that each of the threads are interrelated and are all leading to the same bucket of long-term outcomes that we hope to make. An example of one of those in the green boxes at the end is that we hope to reduce disparities in cancer and chronic risk factors in communities and for individuals for which we're working. So again, just to give you the visual of how the project is connected overall. I'm going to go ahead now and turn it over to, I believe it's Marianne Schilling that's going to take us through some details on the prevention education program.
Yes, good morning. This is Marianne. I'm going to tell you a little bit more regarding Cancer Clear and Simple. It's a set of educational materials about cancer. It includes a curriculum, a facilitator guide, and a number of educational handouts. All the Cancer Clear and Simple materials incorporate health literacy principles, and they're designed to build knowledge and improve health-related decision-making by the class participants. Cancer Clear and Simple was originally developed for use in rural communities, and it's also been adapted for use with other populations and is currently available for both rural, African American, and Latino populations. And in a few minutes, Cody Frederick will tell you more about that. So there are 3 related and distinct modules to Cancer Clear and Simple. The first module is about cancer basics, which covers what cancer is, what the risk factors are, how cancer starts and spreads, and how it's diagnosed, plus what the stages of cancer are. The second module, Cancer Prevention, teaches how cancer can be prevented and how participants can promote self-care and health choices. And the third module is about cancer screening and detection, which supports early detection through participants completing the cancer screenings recommended by their healthcare provider. So we really encourage participants to have a healthcare provider and have a relationship with them. Let me tell you a little bit more about Cancer Clear and Simple. It's really a grassroots effort that started in 2010 as a National Cancer Institute pilot project in partnership with the UW Carbone Cancer Center's Cancer Health Disparities Initiative and UW Extension. After a needs assessment was conducted in a 16-county region, which is the catchment area served by the UW Carbone Cancer Center, Adams County, Wisconsin was identified by the Cancer Health Disparities Initiative as the pilot county to address rural cancer disparities through an educational program. Just to tell you a little bit more about Adams County, Wisconsin, it's a rural agricultural county in central Wisconsin. It does have a higher than average cancer mortality rate. It typically was in the bottom 5 of 72 counties for health rankings. So the education resource that we chose was Understanding Cancer, which is from the Alaska Native Tribal Health Consortium. That was selected by the Adams County Cancer Awareness Team, which I was one of the original members of. Understanding Cancer was adapted for rural audiences through a 3-tier testing process, and that resulted in the new educational resource, Cancer Clear and Simple. The plan for implementing Cancer Clear and Simple in Adams County included presenting information about the program and teaching the program to a variety of groups in the county, including service clubs, home and community education groups, senior meal site participants, and Strong Women, Strong Bones exercise class participants. So a number of rural audience groups was reached through Cancer Clear and Simple. I'm going to turn this over now to Cody Frederick from the Cancer Health Disparities Initiative.
Thanks, Marianne. Thanks, Marianne. I just want to go through really quickly a couple of examples of kind of how Cancer Clear and Simple works and what some of the health literacy principles are that are incorporated into the materials. So you can see some of the previous materials and kind of informational handouts that were available that Cancer Clear and Simple tried to improve upon were things like this from the National Cancer Institute. There's difficult language, complex messages, dense text, very little white space, there's no visuals here. So what we did to improve upon this was trying to incorporate things like those visuals, white space, things like that, simpler language, overall Cancer Clear.
Just talking about the health literacy principles that we're using with these handouts, and as he mentioned, these are at an 8th grade reading level because of some of the wordage or verbiage that is included with them. But the feedback that we've gotten through testing and from participants is that these worksheets or handouts really help them to understand the primary cancer site and how cancer spread and what the stages of cancer are. And as you can see, these are colorful diagrams that also support the concepts that are included in the Cancer Clear and Simple lessons. This next slide shows some of the concepts that we teach in the risk factors and prevention, and we are using some maybe familiar ideas that people have seen in the past, such as choosing my plate, but we encourage the participants to think about their personal choices that they're making around their health and have them look at what they can add, what changes they can make, and what better choices they can make that day or that week to lead a healthier life. Also, if you'll notice on the left side of the sections, there's just some brief, it's a compilation or the basic ideas of what's included on the pages. So the Cancer Awareness Team really felt that helped participants to understand what's included in the content. This is showing some of the activities. This is a very interactive educational program. So the class participants have some hands-on activities that they can do. We do have a Cancer Clear and Simple website that supports facilitators in delivering Cancer Clear and Simple throughout the state of Wisconsin. You'll hear a little bit more about that later. We have here the Cancer Clear and Simple cup activity that shows people how to think about how cancer starts and spreads. We do follow health literacy principles, and in addition, we have on our Cancer Clear and Simple website the videos that we've made to support facilitators in delivering the program. We'll also talk a little bit more about where you can find these materials. So there is a 3-module curriculum, which I talked about earlier about the cancer basics, prevention, and early detection and screening. There's also a facilitator guide, and there's 45 plus handouts. These handouts are divided by information sheets on a variety of topics regarding cancer, such as breast cancer, colon cancer, skin cancer. So some of the more common cancers. There's also questions to ask your doctor and healthy tips and ideas. So I see there's a question about what age group this is targeting. I'll get to that in just a moment. Thank you, Wiley. So you can find this information on the Cancer Health Disparities Initiative website, and the website address is there at chdi.wisc.edu/Cancer Clear and Simple. The age group that this is originally targeted for is adults. This has been delivered to high school health classes also, but it's not the total curriculum. It's actually those topics that are more specific to that age group. So it includes testicular cancer, for example, the cancer basics, skin cancer, and using some good prevention around skin cancer for that younger audience of teens or adolescents, for example. So if you want more information, we'll have at the end as far as adapting for a younger audience. You can contact Cody Frederick, and he has some more information about that. Okay, so since Cancer Clear and Simple was developed, we actually started delivering it in Adams County in 2013. It's gone statewide. We've implemented it in the counties that are in blue and purple. So the original counties before the USDA NIFA Rural Health and Safety Grant are in purple. And then the blue counties are those counties that have been reached since our USDA NIFA grant was implemented. We titled that Reducing Rural Cancer Disparities Together. So we've had the statewide implementation with over 50 new facilitators trained. Since it's been developed, we've reached over 10,000 rural residents either through classes or outreach activities such as community health fairs. There's continued support from the National Cancer Institute. Through Cancer Health Disparities Initiative, they've adapted Cancer Clear and Simple for African American audiences. They just newly released a Latino adaptation also, and there's multiple research projects, including one through the American Cancer Society. So you're seeing here some pictures of the Cancer Health Disparities Initiative staff, and also some Adams County Cancer Awareness team members. Okay, so I'm going to turn it back to Katie, and she's going to talk next about the systems changes.
Thank you, Marianne, and thanks for stepping in for Cody there. So this thread I'll be turning over to Kathy Stats. It's basically the thread of activities in our project that are designed to focus on community level policies, systems, and environments that may contribute to rural cancer disparities. The primary effort we're using within this project is a community coalition coaching model to help community-based coalitions look at these PSC components that may contribute to disparities. This next slide is just the part of the logic model blown up that pertains to the coalition coaching work of this project. And to describe in depth more what we're doing in that thread, I'll turn it over to Kathy.
Hi,
Stack.
can everyone hear me okay? Either via chat? Okay, great. Thanks, Katie. So I'm Kathy Stotts. I am great. Thank you. I am serving as the coalition coach for this part of our Reducing Rural Cancer Disparities Together project. So right now I'm just giving you the roadmap of what I'm going to talk about for the next few minutes. So just thinking about what coalition coaching is, what that frame looks like. When we say PSE, I know in this world of alphabet soup, it's always nice to dig into what those acronyms are. I'll give a little overview of what coaching in the 4 counties I'm working with looks like, and then what the impacts of coaching are. So what is coalition coaching? There is a guide that I referenced at the bottom here, my citations, that we used as our frame for this project for community coaching. But the only difference between community coaching is oftentimes a community coach will work directly with a coalition. But and I'll talk about this in a second, am working with our colleagues at UW Extension and up to 2 others on a coaching team who are the leaders in the coalitions. But I pulled one of my favorite quotes from this field guide, that a community coach strengthens the community organization's effectiveness by looking beyond what groups do to change to how they approach the work of changing. This model is fairly different than a traditional kind of technical assistance or expert help kind of model that I, being from one part of the state and generally from a more urban area, am not going to necessarily have the answers for what is going to work best in the counties that I'm working with, which are primarily rural. So I'm there as a guide on the side. I'm there to ask questions, process with them, reflect, versus me coming in and telling them what to do. It honors the local knowledge that already exists from folks in the community. So thinking about what policy systems and environmental changes are, so it's changes to the larger structures and systems in which we operate in. Obviously, we all know that we do not live in a vacuum, and the things that folks are doing individually are very much affected by the world around them in their community. So that means policies, which is written laws, systems, which is sort of social norms and things that go on within any sort of institution or community, and then environmental is the physical changes that the coalitions that we're working with might advocate for. So those are the 4 counties that I'm working with, Ashland, Oneida, Clark, and Waushara. So each of our colleagues and the coaching teams that we're working with on this project worked with already existent coalitions, some for longer or shorter, but counties submitted applications. They are also all facilitating Cancer Clear and Simple, and that there was some indication of readiness to work on PSC level initiatives if they weren't already. So this is very different than your networking groups or more programmatic groups. These are folks that are working in their communities to advocate for these systematic and structural changes. So I separated the year for our coaching project into 4 quarters because it went from October to August this year. It ends August 30th. So instead of quarter 1, 2, 3, 4, I thought it might be less confusing for quarter A, B, C, D, hoping that that's the case. But we separated goals for each of the quarters, for each of the coaching teams to achieve. And each of them have taken it very differently, but it's kind of the general life cycle of some sort of initiative within a coalition, that you first assess shared vision, draft a logic model and select your goal, develop an action plan, and then implement the action plan. So I'm trying to advance. Okay, so we took our steps for the initiatives that our coalitions are going to be working on and aligned them with the County Health Rankings and Roadmaps Action Center. I'm not sure how familiar folks are with the County Health Rankings and Roadmaps Action Center. I'd be happy to, and related action cycle, which is what this framework is. I'm not going to go too in depth with this right now, but I can answer questions at the end of this call about both this model and the hub of resources that County Health Rankings and Roadmaps provides, that all of these steps are, you can click into them on the website, and they are hubs for tools and resources across the web that coalitions can use to better their work. And like I said, they're in line with our quarterly milestones. All right. So for our coaching, these are the things that have been going down in the last year. I have a call with each of the coaching teams per month, partially as a check-in, partially as time to process, just really taking time to look meta at the work that they're doing. Sometimes when you're in the work, it's hard to take a step back and really think about what it is that we're doing. And then, as the quote mentioned before, how we are doing that work. Per request, I will go to the counties and do a site visit, which generally has either been me observing a coalition meeting and then processing with them afterwards about what happened at that coalition meeting, what their roles were, what goals they wanted to achieve, or time that we just take as the group to really talk in person. In person is really the way to get to the heart of some of the issues that we're grappling with. And there's no coalition that's free of issues or nuances or dynamics or things that need to be worked through. I often joke, anytime you gather a group of human beings together, there's inevitably going to be something to work with. So that's time both with those calls and those visits for us to work through these things. For each quarter, I work with the counties to establish action plans, so we have an understanding of what each county coaching team is accountable for, and just so I can keep track of things, because especially when you're working with 4 different coalitions, it's like, wait, are you the one that was doing the this or the whatever? For my sake, organizationally, it helps. Quarterly, we do large group calls. So for each of the milestones, I have a suggested tool for them to use. They don't necessarily have to use it. But in my experience in coalitions, I have found those tools to be helpful. So I will introduce one that aligns with their milestone. And it's also time for them to give each other updates and connect across coaching teams, because many of them have similar things that they're working on. There are also 2 in-person meetings that we've hosted. So one in October was our orientation, and in August we're going to be doing a wrap-up, which will be a kickoff to a larger coaching and leadership skills training for other UW Extension colleagues. Really excited about that. And then Katie will be talking about our evaluation activities, but ones that are specific to coaching are that I write a weekly journal about my coaching activities, which has been such a rich experience for me to not only reflect on what I'm reflecting with the counties, sort of meta to the meta work that I'm doing, but time for us, or for Katie and I, to be able to really gather qualitative data about the journey that each of the counties has been on so far. We do post-call evaluations, so every time I have one of these monthly calls with the coaching teams, they fill out a couple question survey about not only how I'm doing as a coach, but breakthroughs they may have had or new things that they discovered through these calls. At the orientation, what we're going to do in August is a large group interview. And in October and August, we are also asking them to put out a coalition functioning scale for the group to assess itself on how it thinks it's doing. And lastly, these are the impacts that we've found so far. That in another resource that I utilize for guiding my coaching work, that coalition coaches help a coalition to identify missions, strategic plans, reflecting, moving forward in spite of setbacks, because as I said, there's always going to be setbacks. Anyone that's worked in a coalition knows that's true. Recognize and celebrate success. I really enjoy the monthly calls that I have with the coalitions because we're able to talk about what has worked and then planning for the future. So through the evaluation efforts that we have conducted thus far, we have found that the coaching sessions are set aside time to get work done, and the counties really like that. With a million things that they're working on, just having set aside time to work on one project is really helpful. They don't have to prepare necessarily ahead of time for what we're going to do, that we're able to do it in that moment. And last is that the coach keeps the team accountable for what we have scheduled internally and what they have proposed to do externally. Thank you.
Thank you, Kathy. And as those of you listening can tell, the community coalition component, the coaching that Kathy's doing is really process heavy and could be applied to any work supporting any kind of coalition in a community. So lots of resources there that can be translated both to chronic disease prevention and cancer disparities work, but also all kinds of things. And obviously the end goal of her coalition coaching this year is that the groups are able to use that coaching and be guided towards identifying, prioritizing, and addressing policy systems and environmental change. So that's where all that great process work is going. My major role in the project has been as evaluator, as I mentioned earlier. I was charged with developing and implementing an integrated evaluation plan that ties all the various project components together. I was asked to employ a developmental evaluation approach, which essentially means I'm fully involved in all of the project planning and decision making and help to guide the project team so that we're able to document outcomes. I helped strengthen the evaluation components of Cancer Clear and Simple and develop a means to measure effectiveness for our coalition coaching. So here's an example of the evaluation components, some of them anyway, in Cancer Clear and Simple. On the left, you'll see a pre-test. There is a pretty standard pre- and post-test for learners in Cancer Clear and Simple that already existed in the modules when this grant begun. I worked to help strengthen that a little bit and add a component that focuses on behavioral intention in addition to knowledge gained. We also embedded several new evaluation tools within the curriculum. The intent was to add evaluation tools that could be incorporated into learning activities to reduce the burden for participants while also allowing us to gather additional information on knowledge gained and behavior change. So you'll see on the right side of this slide a postcard. This is a postcard we use in the one of the lessons, Cancer Clear and Simple lessons. It's used as part of an activity where participants are taught how to develop a SMART goal related to cancer prevention. So they go through some of the learning components of what a SMART goal is, how to develop one, and then participants are guided in a process to set a specific SMART goal for themselves around cancer prevention, and based on what they've learned in the series of lessons prior. They then write that SMART goal on this postcard, and we then collect those. So that allows us to do two things. We can record the goals that they have written on the postcards, which essentially gives us a long list of narrative data about what behavior changes they intend to make. And then we also send this postcard back to them in 3 months' time as a check and a reminder of the goal they set for themselves. In the systems change evaluation, Kathy already went into this a little bit. Basically, we're looking to evaluate the effects of coalition coaching on enabling these coalitions to move towards PSE changes that can reduce cancer disparities. The evaluation approach is largely a series of mixed methods that happen within a case study in each county. So I basically have 4 case studies ongoing right now. Kathy mentioned that we did an initial group interview of the coachee teams at the beginning of the year, and we'll do that again at the end to look for changes. And we also, as she mentioned, administered a coalition functioning scale. I'm displaying here just a portion of it so you get an idea of what that looks like. This was adapted from a tool that was created by Ellen Taylor Powell, a former evaluation specialist here at UW Extension. It's designed to get sort of a point-in-time assessment from each coalition member on how they perceive the coalition functioning on a variety of scale topics. So you can see some of these on the scale on your screen. For example, what extent do they feel the coalition has a shared vision? Or to what extent do they feel like the coalition has effective decision-making procedures in place? So having administered this at the beginning of the project, Kathy can work with the coachee teams and look for areas where the process of the coalition is working really well from members' perspectives, and also where areas where members are perceiving things aren't going so well. So it can serve as a tool for them to identify places to focus their work. And then again, we'll use this at the end of the coaching year with the members again to see if there's been change in any of these measures. I'll jump through these last 2 slides rather quickly. Just wanted to point out some of the places we've been able to highlight our project. The last bullet there being this webinar, but we've had a few national and obviously some statewide opportunities to disseminate our project. And just to leave you with a few opportunities that this project has afforded. Marianne and Cody alluded to some of the additional opportunities for outreach that have happened in some cases parallel to this project, in some cases as direct outgrowths of this project. And so we're proud to see sort of this growth and expansion of the program that we've started these past 2 years. We've alluded to this earlier, and some of the questions called this out, that all of the materials for Cancer Clear and Simple, both the learner materials, the curriculum itself, the modules, and the facilitator guide, the variety of evaluation tools, the videos that describe the activities are all available on the website. They're free for anybody to use anywhere. They're viewable, they're downloadable. So we're hoping that helps this project stay sustainable over time. And then finally, we're proud that as part of this project, we also engaged a variety of stakeholders in a statewide rural health advisory committee. These members initially were brought together to provide input and guidance as we developed and carried out this project. But we've also been able to engage them in a conversation about rural health equity. Together, for example, we did a series of exercises over 2 full days to map out actors, various stakeholders, and people that we would want to engage in rural health systems to address rural health equity. And we've had some really, really rich discussions in that group about potential areas of shared work. So that advisory committee will continue with leadership from UW Extension after the grant ends. So we're happy that that is in existence and those folks are well and interested and engaged in what we're trying to do. So I'll end there. I'm leaving you with a slide with the contact information for the individuals that presented to you today, and I know each and every one of them is more than happy to field questions via email. And I guess at this point I'll turn it over to Mark.
Yes, thank you all for sharing this program and how it works. If you do have a question, you can just type it in the chat section below for the participants. I think you've answered the other questions that were had been there earlier. And then while we're waiting for questions to come in, it would be really great if you would complete this evaluation form. It really is helpful for all of us if you take a few minutes to provide some feedback. I see a comment from Holly, but not a question. Peggy Edwards is typing. Thank you, Holly. So Peggy has a question. Is coalition coaching occurring in other states? Katie, would you like to take that?
I'm actually going to turn that over to Kathy Statz, who's got the most connection with the coalition coaching. Kathy, can you share some of the efforts as far as you know that might be happening with other states? Kathy, if you're speaking, you're muted.
Thanks for catching that, Katie. So the model for can you still hear me?
Yeah, you're okay.
Can you hear me okay? Okay, great.
Yeah, we can.
Good. So the model for coalition coaching that we utilized for this project came on the tail end of a project that was a childhood obesity project. I forget the exact acronym. That was housed at UW Extension and partnered with a number of other Midwestern extensions. So there was a coalition coaching component implemented in, I believe it was 4 other Midwestern states. So where that went afterwards, I would have to follow up with that, but there has been this sort of effort implemented through that project, through the 5-year childhood obesity project that happened. It just ended last year. So other coalition coaching efforts through county health rankings and roadmaps, they have a group of coaches that work with folks around the country. And so that is also happening, I don't know, every single coalition that they're working with, but I know that many of the coaches have targeted states that they work with. So those are the first ones that come to mind, was the project that was housed through the group of extensions, and then also what County Health Rankings and Roadmaps coaches are doing. So if you want to find out more about County Health Rankings and Roadmaps coaches, I would recommend going to the County Health Rankings and Roadmaps website, and you'll find information there. I hope that answers the question.
And this is Mark. Just to add to that, the North Central Regional Center for Rural Development has been working on a grant called Community Assessment and Education to Promote Behavioral Health Planning and Evaluation. And as part of that, that's a USDA DHHS funded grant. And as part of that, we've developed a curriculum that sort of combines community development, coalition building strategies and tools with mental health literacy to empower extension, people within extension, to work with communities to address a variety of behavioral health challenges, including things like addiction that might be emerging. So that's a little bit different, but I just thought I'd mention it. You can go on our website and go into programs, and you can find the CAPE program there. Are there any other questions or comments? Well, I think maybe now is a good time to end our session. Thanks to the participants for coming and joining us. Thank you to all of the presenters for sharing your project. Really great stuff. Have a good afternoon, everyone.
Thank you.